Hi, good morning.
Good morning.
Good morning.
So it's funny, when I was first contacted by Michael Stantz, who's the coordinator for today's symposium, he asked if I would speak about urban farming and land, and I just said, that's not my expertise, but I have a colleague who's fantastic in those areas, and that's what she works in, and he snatched her up, and then he called me back again and said, hey, I have another idea for you. So would you like to speak about food and social justice? And it's right in my bailiwick. It's something that is just a part of who I am as a human being, and it's also a piece that I love to weave into my work at the Food Trust. So to start, the Food Trust is an organization that's a little over 20 years old. We started out at Reading Terminal Market in Philadelphia, if any of you have visited. So it's a great hub of activities. You have local farmers, you have food entrepreneurs, you have people from all over the city of all types of diversity coming in to frequent the market. So at the time, the manager of the market, another Dwayne Perry, got to know his customers, got to know the merchants there as well. And in speaking with the customers, he wanted to know, why are you traveling from North Philadelphia, from Southwest Philly, from West Philly, all the way to Center City on public transportation and lugging back carts full of groceries once a week? And the response that he got from these little old ladies and from these tired mothers is that we can't get these things in our neighborhood. So anecdotally, he understood that there was a problem. He started working with a grad student who was interning there, and he started procuring fruits and vegetables from the local growers, loading up a U-Haul once a week, and set up a farmer's market, the first one, at the Tasker Homes in South Philadelphia. And that's how we started as an organization, and we're still true to those roots. We really want to make sure that everyone has access to healthy, affordable food and the education they need to make healthy decisions for them and their families. So a lot of what drives our work is around obesity and obesity prevention. And this was a map that came from the CDC a few weeks ago, which looked at the prevalence of obesity by race. And there were some really startling things. One, I was shocked that even Colorado, which is highly educated and the healthiest place you can think about on earth, really has a problem as well. So even in Colorado, the state with the lowest rate, it's over 20%. 20% of its population are obese. And Arkansas, which tops the list, is at 36% of the population being diagnosed with obesity. And we know that more than 1/3 of the US, that's about 79 million people, are obese. And we know that that correlates to heightened rates of cancer, hypertension, diabetes, and it's the leading cause of preventable death in this country. And the estimated medical cost around that was $147 billion in 2008 alone. We also know that obesity affects some groups harder than others. So this map shows it breaking down by ethnic groups. So we see that African Americans have close to a 48% obesity rate, and Hispanics, 43%, whites at 32%, and Asians at about 11% overall. And for African Americans, there are 33 states with an obesity rate of at least 35%. And we also know that obesity and socioeconomic status are tied. I was not surprised to learn that higher income women are less likely to have obesity than lower income women. But I was really surprised to see that African American men and Mexican men with higher incomes had higher rates of obesity. I don't understand the significance or why that is, but it's just kind of this factual information that's coming out. We also see that there's no significant relationship between the education that someone has as a male and obesity, but we do see that there's a correlation with women. The more educated you are, the less likely you are to be obese. So Dr. Donald Lloyd Jones is from Northwestern Medical School, And he puts it properly. He says, obesity is the largest epidemic of chronic disease that we've seen in human history. And again, we're trying to figure out why that is and figure out what works and what's working with some groups and why isn't it working with other groups. We know that there are many social, cultural, economic, and environmental barriers. So income. Folks with limited income have to make different kinds of decisions. Sometimes it's a choice between eating healthy and paying your rent, or being able to provide childcare or cover healthcare costs. There's also perception, right? So people believe that eating healthier is more expensive, and there is some truth to that a lot of times. We also know that spoilage is a concern for low-income people. If I spend my limited resources on this food and it's not eaten, it goes bad, then I lose money, I lose opportunities to feed my family, and I just don't have the room to make that kind of mistake. We know that food is tied to culture. It's a very emotional thing. These recipes and traditions are passed down from generations, and a lot of times they're not healthy for us. And when it becomes a staple of our diet, it really has a devastating impact. But we also know that the culture of community and what food is present in neighborhoods and what the prevalence of certain types of food means for communities. So I'm coming from Philadelphia, and I swear that there is, obviously there's cheesesteak and there's pizza and there's Chinese food in pretty much every commercial corridor, which becomes a staple of that community, including corner stores as well. We know that there's a time crunch. So if I'm working long hours and traveling far on public transportation, I just don't have the time. So the perception is that let me grab something quick and fast, which ends up being unhealthy. We also know that households without transportation are impacted at a greater rate as well. If you don't have a car, it's really hard to get to a market, so you end up doing what's fast and easy. SNAP distribution, the way that we in this country distribute benefits to people, right? So you get it, and there's a small window in which you can use it, and you say you get it at the first of the month. By the middle of the month and towards the end of the month, those purchases that you made for healthy food are gone, and you end up relying on pantries and things that are more stable, that have a more stable shelf life. And that doesn't equate to fruits and vegetables. We look at Americanization, right? So immigrants, the data shows that the longer you stay in this country, the more likely you are to be obese. Inadequate housing, not having a good kitchen, cooking on hot plates, it doesn't lend itself to being able to cook healthy. And all of that stuff is what contributes to the problems that we're having. And Philadelphia, right? And we're definitely one of the biggest, of the big, 10 cities. Our issues around health are the most pronounced. So in 2010, 63% of adults were overweight or obese, and 41% of kids were overweight or obese. We have the highest rates of hypertension at 35% of the population, and heart disease at 5%, diabetes at 11%. We believe that healthy food access is critical for someone's health. And we looked at Philadelphia, right? And this is done about 15 years ago now. About 10 years actually, and we wanted to know where there were supermarkets and where weren't there supermarkets. So we used the industry data, put up the map, and we see the areas in the city that have supermarkets based on sales, right? And this is what it looks like. The darker areas have markets. The lighter shaded areas don't. Okay? Then we looked at income. We wanted to know where there were supermarkets and who lives there. Are you affluent? Are you low income? And we kind of mapped out what that looks like, right? So the red area are where there are no supermarkets or limited access to healthy food retail and poor people. Took it a step further. We wanted to look at where there were high deaths related to diet and income. And when we finally put it all together, we saw that areas that don't have supermarkets, that have poor people, have higher episodes of diet-related disease and death. And that's not unique to Philadelphia, but Philadelphia had the second lowest number of supermarkets in any metropolitan area. There were many neighborhoods where no markets existed at all. We know that this disproportionately affects low-income people, and that there's a direct correlation between access and health. So what we did is we formed what's called the Fresh Food Task Force. And I got crazy with the PowerPoint, and I saw this cool hexagon design thing. So I hope it's not too crazy, but I wanted to show the linkages. So we brought together a lot of people from the business community, from the supermarket industry, from public health, from government, from civic leaders, some elected officials, child advocates, and we talked about these issues. We talked about what I just mentioned, the correlation between all these issues. And out of that conversation, we wanted to figure out what were the barriers that prevented supermarkets from opening in these areas, and what are the opportunities for policy advancements that could correct some of these things. So when we talked to the industry, we wanted to know, why did you leave North Philly? What would it take to bring you back? Answers were some surprising and some things that we kind of knew. So land assembly, right? They said, we want to build a 60,000 square foot supermarket. The city just can't provide those kinds of parcels. I'm moving out to the burbs. We look at financing. It's just more expensive to build in a city. And also, I'm saying this about financing, there also is looking at rural communities, right? And that there was a perception that there was not enough population density in rural areas for us to make building a supermarket a viable enterprise. So we're not going to go there either. So it's not just an urban issue, it's a rural issue as well. There was questions about the demand for healthy food access. People don't want it, is what the perception was. We looked at the regulatory environment and zoning, license and inspection, and permits from commerce in some communities just made it more difficult. So we're not going to go there. We'll go where they're making it easy for us. So lots of things came up. Workforce training and security. There isn't a population that's employable in these communities, therefore we're not going. Lots of things. But the biggest barrier that we saw is that there were no local champions to really take up this cause. Someone who could advocate legislatively for these issues, and we found that in the form of, at the time, the appropriations chair, Dwight Evans. So he, and as well as a lot of others, helped put together what's called the Healthy Food Financing Initiative. It was a $30 million investment by the state that was managed by a private bank, the Reinvestment Fund, and they attracted private dollars to that pool of funds and started making grants and loans to businesses that wanted to open up in areas where there weren't supermarkets. And we saw that through this effort, we had close to 90 new or renovated stores throughout the state of Pennsylvania. And there were residual benefits, like 5,000 jobs were created and tied to it. And over 500,000 people now have access to healthy food. And this public-private effort really is seen as the example of how policy can really make a difference in public health. And this, again, is not unique to Philadelphia. So this is just one example of what it means to be underserved and not have resources. So this is a map that the Robert Wood Johnson Foundation put out, where you look at the difference of a few miles between one community, which is up north, and more of a more urban-centered community, a few miles apart, a 25-year life expectancy from birth difference. And that's talking about being under-resourced in a real stark way. But what we're really proud of is that we had the opportunity to have this conversation, not just in Pennsylvania, but in New York, and in Illinois, and in California, and New Jersey, and a dozen other places, including Louisiana. And it has gained traction. So the Pennsylvania Fund is the model, but there are now a dozen states which have now adopted their own healthy food financing initiative. And there's a federal program that the Obama administration created that also provides funds for healthy food retail as well. So we're really proud of our partnership in the city of New Orleans. This is Circle Food Store. It was opened in 1939, the first African-American supermarket in that community, owned supermarket in that community, serving that community for the entire time until Hurricane Katrina. And through this funded program, they were able to reopen in 2014. And that's the only market in that community still. And it makes a difference for a lot of different reasons, not just healthy food access, but for jobs and for opportunity. And it tells people that they just care. We're talking about justice, right? The perception that people even care what's happening. And you know, public policy is something that has this mystique, right? But it's not. It's simply whatever the government chooses to do or not do. So lots of things here, right? And this is just some examples, but the fight for 15. If people can't make a living wage, how do you expect them to be able to provide for them and their families? It's real. How can they buy healthy food if they just can't afford it? I got into a big fight with my 14-year-old daughter this morning about her obsession with junk food, right? And like Gatorade and how it's marketed. And she really believes that this is better for you than water. But how food is marketed and restricted can be a policy issue. Smart school foods. We see improvements and there was a lot of controversy around the school reform program, school lunch reform programs. But we know that it makes a difference in building active places in communities. All of that stuff is tied to someone having the will to address these issues. We understand from an organizational standpoint that people have no choice, no chance to improve their lives if they don't have the opportunity to. So we want to make the resources available for them. And when we go back really quickly, when we talk about some of these issues, right? I have to, talking about justice, the stuff that happened in Baltimore and in Ferguson was not just about race, and it wasn't just about, criminal justice reform and policing. It was about being underemployed, under-resourced, and people not having opportunity. And again, all of these things are opportunities that tie into social justice. So just a quick show of the food trust programs. So we try to have a comprehensive approach to the work itself. And we started with one farmer's market, and now we have about 30. But we're also working in all the schools, providing education, but also working on policy to get the fryers out of schools, and getting junk out of the vending machines, and also working to help bring active play back to schools and movement breaks. We're in rec centers and church basements, providing nutrition education to families on how to cook produce and how to care for it so it doesn't go bad. We're in over 600 corner stores working with those owners, trying to help them increase the inventory, increase the healthy food in their inventory, and how to make it profitable, and how to market it better so that people know it's there and drive the demand to it as well. But we're also in those stores doing cooking demos, showing people how they can make a healthy meal that's culturally sensitive for them and their families for close to $5. We're working with hospitals to provide health screenings in those corner stores as well, nutrition education. So we're trying to have this comprehensive approach that really looks to get at these issues around public health. And it's not just us. These are just some of the partners that we have. Get Healthy Philly, which is a comprehensive look at not just food development corporations, So again, this is not just us doing the work, we have lots and lots of partners. What we're really proud of, and I saw on the program description, I wanted to talk about the successes. So I painted a daunting picture about the obesity epidemic, but there is progress being made. So in Philadelphia, between 2007 and 2013, we saw that there was a decrease in school children by 6.3%. And that's in obesity. And then there's severe obesity, close to 14% improvement in that. Some of the stuff we're trying to figure out. Why is it more significant for boys than girls? Why did we see the greatest gains in African American boys and Asian kids? And why is there less progress amongst girls and Hispanic kids? So this HYPE program is us trying to empower youth in those schools and in those communities to be the healthy change agents. They're the ones who are leading the movement breaks and Zumba classes in schools and planting urban gardens and having produce stands and encouraging exercise and bringing their friends to the Y for fun days, etc. So that's pretty much it for now for me. Thanks, and I'll pass it to...
You know, maybe we should do some questions. I think we have a couple.
Okay.
We'll do questions. It might be easier that way.
Sure.
Very well
You
done.
look great.
Great. Tells, it kind of captures what we're about and tells the story. Now, when I was asked to be part of this panel on food and social justice, and I said, wait, that's the last word of the video. I think I'm going to share that. So, anyway, thanks for having us here. And it's really an honor to meet Dwayne and learn more about the Food Trust. So, in a way, we are another grassroots organization, but we've kept our model very small, very local. In fact, Bucks County is the biggest part of what we do. We've expanded a bit into Philadelphia, and over on the Jersey side, since Roland Harvest got started at this food pantry in Lambertville. You guys know Lambertville, New Hope area? Okay, so imagine this, that you're in New Hope and Lambertville, a destination that people come to from basically all over the country. It's a wedding destination. New Yorkers have weekend homes. This is not an area that you would associate with hunger and poverty and food insecurity. But the more that I was volunteering at this food pantry, I just started peeling off the layers of what was right in front of us, and that most of us don't get to see. Most of us think about hunger as Philadelphia or Trenton or Biafra. I'm dating myself back to Live 8 times, I know. It's not something you expect to see in a prosperous area, but this is in fact what's happening now. And it is an injustice, it is a flaw of social programs. It is for so many of the reasons that Dwayne so well laid out, the fundamental problems that none of us is going to fix alone. It's going to take a long time. But meanwhile, it's left us with such inequity and such food inequality and income inequality that you can't turn a blind eye. We need to know more. We need to use this opportunity to spread awareness that the new face of hunger and the new face of poverty and food insecurity, it's you, and it's you, and it's me. It's one catastrophic illness away from being a comfortable middle-class person to really being desperately in need. It's one job loss away. It's one home foreclosure. We are seeing so many more people come into food pantries who used to enjoy a middle-class life, and in fact, they still have nice cars they drive up in, right? And they still have cell phones that they're using for communication. But they are so underwater in their mortgage. All of their money is going to pay their mortgage. And what's one of the first things you do when times are tough? Again, as Dwayne said, people will make very, very difficult choices nowadays because they are forced to. And because of the 2008 economic recession, yeah, we hear about the recovery, but it's not helped an entire segment. The lower earners have not been brought up by the recovery. I'm starting to sound like Bernie Sanders now. The
Nothing
truth
wrong
is,
with
there was a
that.
lot of conversation in last night's debate about social injustice and social reforms. That took a big role. I thought it was going to be about ISIS. No, people in this country are starting to become aware of what's not right and what's not fair for so many of us. You know that 48 million people in this country are food insecure? All that means is that you're not really sure when your next meal is going to come, where your next meal is going to come. Or a little broader stroke, food insecurity means that in the last year, at some point, you've not been able to put food on the table for your family. So that's 48 million people. It's 21% of all kids in this country. Maybe you guys are here, you're obviously concerned, we're preaching to the choir, and you're probably aware of all this, but I'm just going to throw out some more numbers. And remember, when we're talking about numbers, we're talking about people. We're talking about families. We're talking about our neighbors. We're talking about the school bus driver, the school teacher, the pastor in your church. I've seen all these people walk into the food pantries that we are helping. So 21% of kids, 48 million people. 12% of seniors. You've heard a lot about food insecurity among kids. There's been a lot of really good awareness. And in fact, there's been a lot of momentum for food waste, food recovery, food justice, hunger, food insecurity. I was at a conference in Washington last week, and it was to capitalize with major hunger groups, and there's little old growing harvest. That was very cool. But to capitalize on the momentum that's being built right now, the awareness that is being put out there about this issue. For our purposes, food recovery, food waste, hunger, social justice. Now, if any of you were lucky enough, for example, to see John Oliver and the bit he did on food waste, I encourage all of you, don't be offended by his language, because when you have a serious issue and you present it so well researched through satire and humor, you get a whole new segment of the population to pay attention. And it was brilliant. John Oliver hosts this show at 11 o'clock on Sunday nights this week. And this has gotten millions of hits. I personally had 20 friends send it to me within about a day. So I encourage you to see this. The take on food waste, how it's tied in with food justice and with hunger. So I don't have a link for you. So when we're talking about food and we're talking about social justice, that's so much about what Rolling Harvest is. Started at a food pantry in Lambertville, in this very affluent area where you would never expect to find hunger or deprivation of any kind. And it simply was a matter, as I said in the video, why are we giving away mac and cheese? Why are we giving away Dinty Moore beef stew? Sorry, Hormel. Anyone here with Hormel? There may be a place in a pantry, in your own pantry at home, for these kind of guilty pleasures when you want them, but it's not a source of nutrition. And what we were seeing in 2009 when we were doing this is the bulk of fresh fruits and vegetables were coming from supermarkets. And they were being pulled from the supermarket shelves about 10 days after they'd been out. It's a great initiative of supermarkets to do this. But often the food pantry volunteers would have to take a lot of their time and go through the stuff that really wasn't quite edible. And it just so happened that when I was at Fisherman's Mark Food Pantry in Lambertville, it just so happened that within 2 weeks of starting there, the New Hope Farmers Market opened up. And it was less than a quarter mile away. So just because I had some disposable income, I had a car, I could go to that food pantry and fill my car with beautiful local vegetables, fruits, meats, eggs, and I could feed my family so well. And the next day I'd go back to the food pantry and see the same thing. And it just smacked me like a lightning bolt. This is so wrong. This is so unjust. This is disrespectful to the people coming in at their most vulnerable, asking for help. Why shouldn't everyone be treated with the utmost respect and given the choices that they need, regardless of whatever financial issues they're dealing with? So that's how Rolling Harvest got started. We started one food pantry, one farm. More and more farms started to hear about what we were doing, and the unexpected benefit of what we were doing, it was really extraordinary. what this means to the farmers, and a lot of small local organic farmers who work so hard and are not really in it for the money. They're in it for a mission, sustainability, nourishing, stewardship of the planet. These small organic farmers, where it's so labor intensive, they didn't want to see their food going to waste, just nobody had really asked them. They would compost it, or it would go to feed animals. Sometimes it would go into landfill. We've got a farmer working with right now in Yardley, Pennsylvania, that I have to say, they package their greens, you know those plastic clamshells? Well, when they've got surplus, it goes into the dumpster. And it's such beautiful, beautiful food, so much better than anything we were seeing coming in from supermarkets. So the farmers really started to talk to each other, and bottom line is, in just a few short years, we're now providing, we just passed our 500,000 pounds mark, but if you've ever seen 200 pounds of lettuce, for example, it fills a van. It fills a van. There's a lot of greens. So we passed our 500,000 mark, which means that there's 2.5 million servings of additional, really healthy fruits and vegetables, and now organic meats with our partnership with Applegate on the plates of kids right here in Bucks County. That to me is justice, that is fairness, that is respect. And we are now serving, what was it, about 63 hunger relief sites. And we've got 30 farms on board. So apparently it just needed a model for logistics. How are you going to get all of this beautiful surplus from the farms to the people who need it the most? And by keeping Rolling Harvest small and very responsive, we can get those last-minute calls from farmers who literally can say, oh my God, Kathy, it's going to be 101 tomorrow. My entire field of broccoli won't survive. Can you come and take as much as you can? Or another farmer who said, I've lost the lease on this land. The bulldozers are coming in. And in about 6 hours, we showed up and we got 4,000 pounds of those gorgeous tomatoes. These are extremes. Mostly what we have now are people getting that it's all about access. Same thing Dwayne said. So much of what he said is what we're living with every day. It's so much about access to fresh fruits and vegetables, because it's one of the first things to be cut out of a budget when you've got those tough choices. Paying rent, paying your medical copay, buying your prescription drugs, getting your kids new clothes for school. These are all the issues that take away from a healthy diet. And because we have such a convoluted food system that's been developed, where the most accessible food in inner city neighborhoods, in underserved neighborhoods, the most accessible food is the least nutritious. The least nutritious. The cheapest food. The most expensive food is the stuff that we really need and that you and I take for granted that we have to nourish ourselves. So something's really wrong with that system. An organization like Rolling Harvest, we're not going to cure hunger. We're not going to end hunger. We're not going to end inequality and injustice in this food inequality. But we'll do what we can until these greater policies are brought into place, until there's some real change. And it's not going to happen anytime soon. So I believe we'll be around for a while. Thanks.